Hi, I'm Dr. Danny Pine, one of the deputy editors of the American Journal of Psychiatry, and I'm going to be talking about papers that are appearing in the February edition of the American Journal of Psychiatry. And we have two papers that I'll be describing. So attention deficit hyperactivity disorder, or ADHD, is one of the more common pediatric mental illnesses that clinicians see in their patients. Many studies have tracked the longitudinal outcome of ADHD, and the general message emerging from those studies is that most patients with ADHD will experience remission as they move into adulthood. An important new paper from Sibley, however, should give us pause before we take that conclusion at face value. This study is important because it tracks for more than a decade patients who had participated in the multimodal treatment of ADHD. And this is one of the more important treatment studies of the condition. The new results suggest that many patients will indeed experience a remission of their ADHD. However, when patients who had previously been in a treatment study are followed for many years, lasting remissions, meaning remissions that are sustained for many years, are quite rare. Fewer than 25% of the patients who were followed over this 10-year period exhibited such a lasting remission. And this should make us rethink just a little bit about how we think about the rate of remission in ADHD. Transcranial magnetic stimulation, or TMS, is an approved treatment for major depressive disorder. And there's long been interest in TMS because it's linked to direct stimulation of the brain. Cole and colleagues examine some new ways to administer TMS that might increase its efficacy in patients with treatment-resistant major depressive disorder. And there are two main messages to come out of this important new paper from Cole and colleagues. One is that the technique used in this study is called rapid theta burst stimulation, which allows physicians to administer higher doses of TMS over relatively short periods of time. And in this new randomized controlled trial, there's a suggestion that increasing the amount of stimulation that patients receive might in fact increase the efficacy of TMS for major depressive disorder. The second important finding is that Cole and colleagues tailor stimulation in this study based on the underlying pattern of brain function in each individual patient as measured by magnetic resonance imaging. And this suggests that by using what we know about brain function in individual patients, we might also be able to improve the efficacy of TMS. So this paper is important both because it's the state of the art of current basic science, but also because it suggests that this state of the art is becoming increasingly clinically relevant.